Focus on my camera.
I'm gonna start
So
recording.
welcome to the Governor's Child Foster Care Advisory Commission. Good to see you all, commissioners and guests. I'm Pamela Heisler, current chair, and in my day job, work with Oregon Child Abuse Solutions, supporting state children's advocacy centers across the state local programs. So yeah, I'm in my whatever year it is, I don't know, five, six, who knows. Right as COVID hit is when I joined. So it's hard to tell. All that time kind of bleeds together. So yeah, excited to be here. We've got a lot to cover as always. So who wants to go next?
You want to just call on somebody?
Oh, Alex was gonna go. Go, Alex.
Hi, I'm Alex Island. I use she, her pronouns. I've been on, oh gosh, I don't know how many months now. Not too many months, a few months now on this commission. I work for the Public Health Division at OHA, and have personal experience and work experience in the child welfare system. I was a permanency caseworker for 2 years. Thanks.
Casey Dreer, Commissioner. I just finished my first term as Commissioner and was reappointed for another term, so be with you for the next 4 years. And in my day job, I'm a juvenile dependency attorney here in Lane County. And we'll call on, how about Matthew Miller?
I'm Matthew Miller. I'm visiting today as I'm applying to potentially be on the commission. I'm the owner of Miller's Barbecue, serving out of the DHS office in Northeast Salem. I also serve on the board of Liberty House Child Advocacy Center here in Salem.
Thanks for coming. And do you prefer Matt or Matthew?
I'm good either way, so I have no preference.
All right.
I'll go. I'm Judge Jaco, Megan Jaco, and I'm on the Court of Appeals. I'm actually writing an dependency opinion this morning, but I was a juvenile judge working on dependency cases for about 12 years before that, and so have a lot of experience with these types of cases. Before that, I was an attorney like Casey is representing kids and parents in juvenile court. And I'll send it to Malik.
Malik, excuse me, Malik Alexander, Commissioner. In my day work, I oversee homeless youth services in East Multnomah County for New Avenues for Youth. Yeah, happy Monday, everybody.
Yeah, right. Happy
Uh,
Monday.
and then I will pass it to Donna Haney.
Hi, everybody. I'm Donna Haney. I use she, her pronouns. I am the assistant manager in the foster care program for DHS Child Welfare as a guest. So I'm here as a guest. Thank you. And how about who hasn't gone? Alicia?
Me, I'm just here observing the child foster care system in the state of Oregon and what you guys are doing with it. And because my children were taken in Oregon, in Arizona. So that's kind of why I'm here, just seeing where you guys are going with the system and, you know, maybe hopefully get some answers about where my children went.
Yeah, well, thanks for coming, Alicia. There is a public comment period later in the meeting too, if you wanted to say a few words about issues you're seeing or ways that you would hope to see the system be different. You'd be welcome to share at that time.
Thank you. I do appreciate that.
All right, who do we got? We got Matt and Dean. Gonna jump in with introductions.
Hi,
Duh.
Roll.
Oh.
I'm a detective with Mormon Police Department. Been in law enforcement for more than 10 years. Been a foster parent for about 6 years now. This is my very first meeting. I think I was appointed 2 weeks ago, and I don't think my term actually starts until the end of this week.
Well, welcome. We're so glad to have you. All right.
Yeah,
Last but
so no
not
matter,
least,
oh yeah, so no matter what, looks like my eyes, I still look like I have them mostly closed. So don't, that's just how my eyes normally look. Don't judge it. But
no
anyway,
judgment here.
yeah. So Dean Salazar, that's why you saw me doing the little trying to look more awake. Anyway, Dean Salazar, self-advocate for the foster youth community as well as the autistic community and a bunch of other things. I serve on the Portland Children's Levy in addition to this, and the Oregon Commission on Autism, which is going defunct this year. So, and then also, I'm also just a quick extra thing or two things. One, I'm going to Hawaii today after this meeting. So, yay. And
Jealous.
two, yeah, and two, I might actually become a policy staffer or intern, paid intern to Portland City Councilor Jamie Dunphy. So yeah,
Yes. Those are amazing things.
yeah, so I'm excited about all of that.
What island are you going to?
Oahu, so Waikiki and Honolulu. So,
So,
and funnily enough, I'm also running for Dave Douglas School Board right now. But the reason I mentioned that is because, long story short, my ex misunderstood autistic traits and she bought into the whole like narcissism thing or whatever, right? Which can unfortunately mix things up with autistic people in terms of recognizing the differences. And so she's not going to be there, but she's from David Douglas. So when because we both went there, and we dated in high school. So so lots of exciting things happening. So
yeah, that's a lot. Glad you could make it today, even though you're off to a big trip.
And I'm last but not least, Ellen Bell. I'm the policy analyst for this commission. Happy to be here today. Happy to see at least one of our new folks coming on. We have one more, not official till the end of the week. And just an announcement that Jessica Hawash is she will be or she has resigned. She was planning on coming to say goodbye to everybody today, but she will not be able to make it. She's moved to Washington State. We tried everything we could do to try to keep her on the commission for X number of months longer. Just like what would there be a period where she could go off? But it was determined through executive appointments that just wasn't allowable through the statute. So she had to be off as soon as it was acknowledged that she had moved out of state. So very unfortunate. And if you have her address or if you want her email address, you don't have it, feel free to reach out to me so that you can wish her well. And I know that we will all wish her very well and miss her.
Yeah.
And Ellen, we only have 6 members attending today, right? So we don't have quorum.
So we do, I think do we have 7? Dean, Megan.
No, we have 6.
Oh, right, because I just wrote, we only have 6. So we need, now that we've lost Jessica, we do need 7. We always need 7. So we can go ahead and take the minutes, but we just cannot. And I did not know, I thought Alicia Richard was going to be here today. Didn't hear that she wasn't. So, and maybe she's still going to join us, but something might have happened at work. So, we'll see. And do you want to just postpone the approval of the minutes and see if I'll message her? And see
maybe she'll come on later, or we push into the meeting.
But then, of course, this will now with more new members coming on with Matt Crowell, who's here today and will be official at our May meeting. Because what date did they give you, Matt, that you would be official?
The 1st.
The 1st. Okay, great. And then the same thing with Jesse Powell would be official on the 1st. Then I think it's the same day.
Oh, okay.
So then we'll be back up there.
Yeah.
Okay.
Well, so we're going to skip the meeting minutes.
Yeah.
We updated about Jessica, new member. So Matt is joining us, even though he's not technically on as a voting member of the commission. Then we have our second newly elected, which I think you all met at the retreat, the in-person retreat in Salem. So Jesse Powell was one of the parents who came and presented and worked with us through that session. So very excited to have both of you on board. Some new fresh faces, and especially honestly to have some law enforcement engagement. This is very cool for us. Dean, you are a riot today. And I'm not going to ask how you're going to come back as a father. We're just not going to talk about that.
We're not going to go there.
So the other update is May is our leadership elections for new chair, vice chair, and secretary. And some folks have stepped forward to fill those positions. Ellen, do you want to review the list? Because my brain isn't working today.
Okay. I'm not sure that we have filled the secretary position for doing minutes. And of course, we do need that for today if anybody is willing to volunteer for that.
Sure.
But we do have our nominees that we'll vote on next month. For our vice chair, Malik has stepped up. So thank you, Malik. Do you want to say anything?
Yeah, I just want to say thank you for thinking of me and reaching out, and excited to play a bigger role in this committee. So thank you.
Yeah. And our new chair will be Casey Dreer. And if you would like to say something, Casey, we really thank you for stepping forward.
In particular, I'm just really excited. I think, we've seen so much growth on this commission in the last 4 years, or at least since I've been a part of it. I know that there was so much work that went in before, but I'm just really excited for this commission. It seems like every time we have a meeting, we're, getting more concrete on the things that we're looking at, and just excited to see where we're going to go over the next few years.
Thank you.
Hey. So secretary position still open? Was that the
Yes,
final? Okay.
that's correct.
Sorry,
So, and if anybody, not to put anybody on the spot, that position, the only requirements of it are not necessarily to attend any meetings outside of this meeting, but during this meeting to take the notes, which you basically use the agenda as a template and stick in the notes. The meetings are also recorded. So we have a recording that is on the website. So that also serves as documentation of the meeting. So it doesn't have to be very terribly detailed, but we do need to take meeting minutes and we post those as well, or send them out as needed, but they do get posted on the web page. And speaking of the web page, now that we have the new members official, now that we know it's also the 1st of May, exactly, the web page will be updated with all the new members. So if somebody is interested in taking the minutes for this meeting, and even putting your name forward for taking minutes on a regular basis, please let me know. I don't need to put anybody on the spot right now, except for this meeting.
Thanks, Ellen. And it used to be that the chair, vice chair, and secretary were kind of a leadership team, and they met in between the meetings to plan meetings and plan things and write the report. But because of the new ethics laws, if 3 of us are in a meeting, it has to be publicized and public invited. And so now it would really just be the chair and vice chair meeting to prep those materials for each meeting. Interesting rule. Feels like, anyway, neither here nor there.
I can take the notes for today.
Thanks, Malik. Yeah, so official elections will be next month. and then those folks will take for the next 2 years. I believe secretaries every year, but the other two positions are 2 years. So
Yeah.
We will go from
Very
there.
exciting. Thank you.
And I will be off the hook.
She'll still be here.
He'll be around. Alrighty. Anything else for order, kind of good of business?
Jessica did just send a message that said to tell everyone that she would miss you all.
Yeah, I honestly almost cried when she said she had moved to Vancouver. I had to pause and because, she was so excited to be on the commission, had such great background and wanted to be doing leadership. So I couldn't believe it. It was, it's one of those things that was best for their family. And so they made the move. And then I don't even think she'd thought about it until we were all talking. And then I was like, wait, what? You moved where? We gotta figure this out. So yeah, send her well wishes if you can, to her and her baby and her family. And I'll get her a message to just say thank you for her time and go from there. All right. If there's nothing else.
We have 10 minutes. Catherine will be joining us. And I don't know if anybody's noted, but I did send out an update to the invitation with a document that Catherine wanted to have on everybody's radar. I think also it looks like Gretchen's with us, and Gretchen wanted to be here for Catherine's presentation. And so that will be
data points for student experience. Is that the new document?
I believe so. I'm gonna have to go back and open it up again.
Okay, I'm opening the right one.
Ellen, I lost track of some of the bills. Do you have a legislative update for us on what's
I actually don't right now. I didn't have that on our radar screen.
Really good
Donna
point.
may be able to answer on some things that would be of interest. There's just been so many bills. We do know that foster care, what was it called? The foster, what was the name of the one that died, Donna?
I don't have the numbers in front of me, but it was the bill to move our foster care, basically ombudsman. It was the child advocate was the language in the bill to the long-term ombudsman. That bill actually died in committee. However, it may pop back up in a different bill. We're not sure yet. Or will probably be put forth again in February. There was a bill to restructure and increase resource parent, the foster care maintenance reimbursement. That unfortunately also did not move forward.
Oh, okay.
Is there any bill that you had maybe a question on? The omnibus bill, the DHS bill is still it's has not moved forward or died yet. It's still folks are still working through that bill and all the different sections of that bill.
And that was one with everybody the here transportation and that kind of stuff, right? Yeah.
And that everybody had weighed in on, and our recommendations did go. So I think they were being taken into consideration, but there were a lot of recommendations on changing that bill. So we don't really know what's happened. That one is still up in the air, huh, Donna?
That was HB 3835. And you're right. It's been, it went through the work session as recently as April 3rd and then did not get a passage recommendation and was referred to rules where it's kind of been sitting for the last 3 weeks.
Yeah. I think there's some behind the scenes work happening with that bill.
Yeah. And I know that Senator Gelser put an alternative forward to that. I actually have not seen that. So
she put forth a few different ones that touched on aspects of that bill. One of them, there was a hearing in the House side last week, and that deals with a couple different things regarding some independent living and also some clarification about criminal background checks and 18, 19, and 20-year-olds who remain in the custody of the department. Which we've never done background checks on youth in the custody of the state, but there was some feedback from the Legislative Council that we really don't have statutory authority to not run those checks. So we're trying to clear that up, and Senator Gelsler-Bluen included that in her bill, which was helpful. There's also a bill to revise the Foster Child Bill of Rights and the Sibling Bill of Rights, and that also it passed the Senate, although there's likely going to be an amendment, and it's being heard on the House side now, and it also had a hearing last week.
What are the changes that it's making to the Bill of Rights and the Sibling Bill of Rights? Do you know?
Well, off the top of my head, I know that it adds some, this is Senator Gelsler-Bluen's bill, and it adds some real specific language around the right to an attorney, the right to a free public education, rights for siblings to either, I'm not using the correct language here, but either live together or continue to have a relationship if they're not placed together. The court can find that that's not safe to do so, but that would be a court finding. Some of this is in other parts of statute, but this would be in the Bill of Rights. To have belongings moved in an appropriate carrier, luggage carrier. Trying to think, and I know Catherine Stelzer popped on, so she can help me if I'm forgetting anything on that bill. I think those are the big ones.
Right to go to school, but
Yeah.
that's already in statute.
Yeah, that's interesting.
Oh, the right to be able to not participate in the resource parents' religious activity. So if there's a particular religious ritual activity, prayer at dinner, for instance, and the child is not comfortable with that or attending services. But my understanding is that there will be amendment on that particular issue, that there was a lot of concern about how that particular point was made over on the Senate side when they debated it, and there may be an amendment. Senator Gelsler-Bluen may put forth an amendment to put an age on that. So the committee actually that held the hearing on the House side asked for DHS to ask some questions in writing about current process and what that might look like now. So I guess we'll see what the bill is at the end. The department is neutral on this bill. We will just work with whatever bill is passed and create the materials and the new materials. For those who don't know, the Bill of Rights are contained in a part of the Bill of Rights is that they need to be made available to children and youth in care, posted, and so we need to and I'm sure Pamela was part of creating the initial documents. So there are some that are for younger kids, some were older. So we'll have to, once whatever it ends up being, we'll need to have some folks work on the new materials so that it's accurate. And I'm not, at least for foster care, not really I can't think of any other bills right now that are that impactful to the foster care anyway. I think there are some on maybe the CPS side that I'm just not that aware of.
Thanks, Donna.
Mm-hmm.
I put you on the spot.
That's all right.
We should have thought of that in the agenda, Ellen. It's the middle of session.
It's the beauty of every month having a meeting.
Right. We thought we had it covered, you know. Yeah.
Yeah, I'm sure we can get information, Malik, on the bills that passed. Maybe that could be an ask of Michelle, Ellen. Just kind of any major child welfare bills, where they land.
And we might, when does so the session ends June, right? Isn't it June? So maybe at our June meeting, we could see if we could have an update from Michelle just on what's, yeah.
Thanks. Just taking note of that.
Well, you would have to by June. We'll put that on our agenda, Casey.
That helped a lot. Thanks, Anna.
Yeah.
I'm so interested to see how 3835 turns out, just because there's just been massive amounts of feedback and, back and forth. So it's going to be so interesting to see where that all lands. And thank you, commissioners who offered feedback in writing so that we could submit it. That was a lot of work and a lot of time. So I appreciate you all taking it very seriously. And hopefully the bill, wherever it lands, is something we can all live with. We shall see. If not, maybe we'll have some more letters to write next year for the short session, depending on how that goes. All right, so next on the agenda is, I believe, Catherine, and she's on. Welcome, Catherine. And I do have pulled up the key data points for students experiencing foster placement, the research.
Yeah. I just wanted to make this group aware of that data. It's not really new data. We actually asked ODE to compile some graphics to make their data look a little bit more easy to read. So for instance, the graduation data is updated annually, but it's in an Excel spreadsheet. So you have to kind of filter to be able to compare groups. And so this really just takes all of that data, puts it in a much easier to synthesize and read summary. They pulled some of the OKID data and referenced some of that. They pulled from some of our publicly available data. And so, like I said, there's nothing that's really new in here. It's just much easier to read and compare to other student groups. And if you scroll down, they do have graduation data through 22-23. And they were able to put the 4-year, 5-year, and all completer data in there. And then they compared it to all students economically disadvantaged, special education, and houseless. And our group, foster care, is still the lowest graduating group. We are making incremental, we're inching up incrementally. So that is good to know, but it's still pretty low. So I think our all completers for 2022-23 gets us up to 60%, and that includes 5-year, and all completers includes things like GED. So I'm happy about that because, it's better than what we've had in the past, but it's still not good enough. And there's a lot of room to make things better. And they put some recommendations and talked about school stability and kind of all of the things that we've been working on in Oregon. I think this year has probably been the hardest year in terms of what I'm seeing as I'm consulting with our child welfare staff. we are having a number of school districts really push back and say, we don't have to provide transportation for school of origin. We're getting pushbacks around doing special education assessments. It's been a really tough year. And so I've been doing a lot of work with Marley, who is my partner at ODE, and she's really great to work with. I think what has been complicated is ODE operates a little bit different than child welfare because school districts have local control. And so ODE can set forth rules, they can interpret statute, they give guidance to school districts, but they don't have the authority to really tell school districts what they have to do. And so I will just let you know, for instance, in the last 2 weeks, I have dealt with school districts that have had their attorneys send us letters about why they don't think that they need to be providing school of origin transportation, which is clearly outlined in state and federal laws. And it is disappointing that they're using their resources to push back instead of just providing students the transportation that they deserve, especially at this time of year. It's the end of April. It does not make a lot of sense for us to be changing schools at the very end of the school year. Some of these situations are situations where we may make that change over the summer once we know that placement in resource care is going to be their resource parent next school year. We are trying really hard to make natural transitions and not move kids, at the end of the school year where they're going to get plopped into a new school. It's going to be the end of the school year. They're not going to get the services they need. And so I've been trying to figure out ways that maybe we can push back at a little bit higher level with ODE and with school districts. We've been using our AAGs to write letters. I've helped our AAGs to write letters explaining why these kids are entitled to transportation, the fact that the school district will get reimbursed for 100% of that transportation. And it's been incredibly frustrating. So I think that I was just here to answer questions from the conversation that we had last time, but I just kind of wanted to let you hear some of the things that we've been dealing with as of late, and it's been really disappointing.
When you get your pushback from the attorneys, how much of it has to do with the fact that they won't get reimbursed by the federal grants anymore?
Yeah, so the way that Oregon structures our School of Origin transportation is ODE pays the amount that they can reimburse from the state school fund, and then they bill ODHS for the rest. We usually get billed for about 30% of it. And that comes from federal 4E and general fund that was allocated by the state legislature. And there's been no changes to R4E right now, and I am not aware of changes to state school fund transportation reimbursement. I think where we're getting into trouble is school districts are not they're not reaching out to their foster care points of contacts who are district wide, and they're not necessarily in the schools, and they're not talking to the people that understand the laws and understand how all of that is reimbursed, and they're just getting their attorneys involved because they don't want to do it. I think what it comes down to is we're seeing school districts feel pretty squeezed in terms of school staffing ratios. So sometimes we've got the money to provide transportation, but there's nobody to actually do it. That's been one of the biggest areas where we've been getting pushback. But I'll be honest with you, school districts haven't really been super willing to be creative in maybe how can we contract with different kinds of transportation providers who can provide that extra transportation. So it's they're making up problems. The legal statements that we've been getting back are really pinpointing the part of statute that says ODHS and ODE need to work together to provide transportation. And they're sending us a letter saying, well, ODHS isn't doing their part when our part is the shared cost contract. So it's just seems to be a lot of missing information for districts. And Marley and I are going to have a conversation with ODE about what we can do different next year in terms of sending communication maybe to superintendents and principals beyond just communicating with the foster care points of contact. So the admins in schools will have a better idea of what that looks like. Oh, let's see. I'm seeing that there's questions.
Oh yeah, I just asked, what did David Douglas in particular say?
David Douglas School District?
Yes.
I don't have a lot of problems with that school district. I think where we're seeing the majority of our transportation problems are in smaller school districts that have less resources.
Like Centennial.
Yeah, I don't get I get less pushback in Portland because they tend to have more transportation resources available.
Yeah, that makes sense.
Yeah, it tends to be our smaller districts and
especially rural, I bet.
And rural. And there is a problem. I don't want to blame it all on schools, but I also get frustrated when a lot of time and resources go into how can we get out of doing this versus spending that time and resources in problem solving how we can get it done. I think that's kind of where I get frustrated. Casey?
We might need more infrastructure before we, that's something that we should look at, I think, because if they're saying we don't have the infrastructure for this, which is, I bet, one of the biggest, complaints, let's go build some infrastructure down in Prineville or something.
Yeah.
Thanks, Catherine. I think that this is a pretty important issue, especially, it vibes with what we've been talking about graduation rates and transportation affecting that. What can the committee, this commission do to be helpful? Like, is there any type of recommendation or anything that we can do to support the transportation issue?
That is a good question. And I might need to consult with Marley on that because it's really over on the school district sides that we're having this problem. And so I don't always know how to solve that problem because I'm not in the middle of, transportation resources over on the school district side. I know that we try to be as flexible as we can. We'll suggest things like one school district transport to the boundary line, the other school district pick up at the boundary line, and you both submit costs from, your side of things. We try to be very flexible in that way. But I think that's a good question. And I think we need to probably elevate it higher up into ODE, where maybe there's not as, I don't know how to say it. I feel like Marley is struggling even within her position to really be a good advocate in the way that she needs to be a good advocate because of, some of the ways the system is designed.
That's really sad to hear. It's interesting though, because I know when way back when I was in care, I had taxis taking me to visits.
Yeah.
Taxis taking me to counseling, taxis taking me to So, and obviously maybe communities that don't even have a taxi, but that felt like a way to be creative and get transportation when you were low on staff. But I don't know if the schools have different policies around sending kids in
They
taxis.
do, and that's part of it is, there's 197 school districts with 197 policies, which is part of the reason why we contracted with ODE and said, as long as school districts are providing transportation under their policies, it works for us. And some of them do use Ubers and taxi cabs as long as they're able to have all the safety guidelines in place. But, in some areas they don't have that. And I think schools are just feeling really pressed for resources. And I expect next year, as we see more budget cuts, it's probably going to get worse. And so I'm kind of bracing for that come next year as we're starting to hear about school districts having to cut back on things. But
yeah.
And in relation to any type of a recommendation, after you have talked with Marley, if you want to just loop back to me, and then I'm happy to share it with the commissioners, or you're always welcome to come back and let us know or give us an update, because I do think in this new uncharted territory and what we're going into next year, what are some ways that that the commission can advocate on behalf of kids kind of proactively rather than reactively would be, and depending on what everybody's thinking is about that. But I know we always like hearing from you and getting your input and working with you to try to make things work better.
Yeah. And I think the other thing that we're seeing is our high needs behavior children. I think because children can go to their school or school of origin, we're seeing a lot more pushback from districts who feel like they don't have the resources to manage a child, say, oh, they really should go to this other school because this other school where they're living in the district has a lot more resources, which is not always true. And so, beyond McKinney-Vento students who are houseless, there's no other group of students who have sort of these two options. Whereas I think our courts are really looking at school stability, because that's one thing that we know clearly increases graduation rates, and it helps with mobility when they're, with their parents and they're highly mobile, or they're in foster care, maybe they're highly mobile. But it's this group of kids that is in the higher echelon of behavioral needs that their resistance to educating them concerns me a lot, because I see sometimes how these kids are talked about in emails with caseworkers, and I can't help to feel, if I feel like they don't want this kid, how is this kid not feeling that? I mean, kids feel things, and you kind of know when people care about you or when they don't care about you. And so sometimes I just read these emails and I'm thinking, how on earth did somebody think to put that in writing? I mean,
oh my God.
So anyway, I'm sorry to just kind of it's been a couple of frustrating weeks, and this kind of happens towards the end of the school year. It's not unusual, but I've just seen more resistance than I have ever doing this job. I am also planning to bring this up. I sit on the State Special Education Advisory Council, and we have a meeting next week, and I'm going to bring this issue up because I feel pretty strongly about things.
Thanks, Catherine. I have one question. So back when we were writing our recommendations and kind of looking at the educational outcomes for foster youth along the whole spectrum, including graduation rates. We were talking about this summer kind of convening a work group, sub-work group. Could this group be looking at that as well? Like what's going on for transportation? How can we partner to make it easier?
I think that's a great idea. I love that idea because I think probably what Marley and I need is somebody else speaking out that's not us.
Yeah. I mean, yeah. Once you get in the system, there's like the local people see you guys as like the ivory tower, and I'm not going to listen to what the ivory tower has to say. I mean, unfortunately, seems how it happens sometimes. But yeah, I think we should put that on the list of things when we meet to talk about educational or just education, period.
Yeah. And I think the other thing if I remember correctly, that Casey brought up was maybe doing some kind of bench tool for school of origin decisions. And I think that's something that would really be helpful. I know that there's been tools in the past, but it's been a long time. And I think we could reach out and include JSIP and see if that would be something that they would be willing to work on. Because all of these decisions play into one another, right? You know, we've got the court who's saying the child should stay in their school of origin. Oftentimes we're agreeing with that decision. The child's agreeing to that decision. And then we have the school saying, no, this child really should go to the other school, and not understanding that these decisions are being made in a thoughtful way. It might not be the forever decision. We may have to rethink it, you know, come summer. But we really don't want to be moving kids at this time in the school year, especially if we can help it.
Yeah, absolutely. So question is, what happens if the school just says no, and you've already moved the kid to a new placement, they're out of the school district, the school's saying we can't do it? Are those kids just forced now to then go to the new school?
No, generally what happens is ODHS is providing transportation, and it's either through staff time, we're using staff to get those kids overtime, or we're paying for taxis and Ubers. And part of the problem is all of the money that was budgeted to ODHS for this school of origin transportation is in a contract with ODE. And so we're not able to access those funds because they're in a very specific contract. And I don't know if we need to rethink that contract and figure out, okay, if school districts aren't going to comply, we need to be able to access that money for ourselves if we're providing the transportation. The other thing is that these battles, I probably shouldn't say battles, take months. So I'll give you one example. We've got a child who's in a charter school. They were attending the charter school before being taken into foster care. They were placed in foster care. Child still wants to go to that charter school. It's not a huge amount of transportation, but it's really difficult for the resource parent to provide. And she's been doing it, and we've been giving guidance to the school district, both myself and Marley, since January, saying charter schools fall into this law. There's pretty clear guidance on it. This is the school the child was going to when they entered into foster care. It's your responsibility to provide transportation or reimburse gas mileage or however you want to do that, and it'll be reimbursed. This first came up in January, and we just got a letter from their attorney last week. So, you know, it's been going on 4 months. And this poor resource parent has been doing everything that they can to get this child to school. We have no resolution. Marley has met with their DOJ, And, then it's stuck in these processes where, okay, now you've got legal teams involved. And so we're trying to problem solve where to go from here. But I think by the time we problem solve it, it'll be the end of the school year. It's still worthy to problem solve for next year, but this poor resource parent, we've been working on this since January. So it's not very timely for people.
It sounds like a great thing to work through in that work group or whatever we're going to call it, committee on education. Yeah, especially based on the data we've seen, how important it is. We've got to figure it out.
Yeah. So I appreciate that you all are willing to help maybe strategize a plan to help us get out of this and move forward, because I just don't want these things it's gotten worse and worse and worse since the pandemic. That was really kind of the dividing line, and when kids went back to school, and since then it has really gotten worse every year.
That's tough. Any other questions for Catherine?
Did we want to do any other follow-up on any of the specific recommendations from last year that we were going to try to keep forwarding or keep moving forward?
Yeah, I mean, I think the plan is to roll that all into the group that starts in the summer, right?
Yeah.
And the goal would be to come out with I don't know, strategic plan for educational outcomes for kids in care.
Yeah.
Like K through 12. So hopefully that group can take those things on.
Yeah. I think that's a great idea.
Yeah.
Just writing a note. Catherine, will we hear from you as that starts to bubble up?
Yeah, I will meet with Ellen, and we can, now that legislative session is kind of slowing down a little bit and we have a chance to breathe, I think Ellen and I will meet and maybe figure out a timeline of when we can get that going, and then figure out who from this group wants to be involved. And then I think the other thing we might think about is, are there other people that we might want to invite, or do we want to keep it just people from this group? I'm open to whatever. I was just thinking maybe it would be useful to have somebody from JSIP be involved as they're connected to the courts. So yeah.
I'm wondering if anybody from Gretchen's group, because Gretchen has been and OCID has been so involved with us. Maybe someone from OCID or yourself, Gretchen, would like to be involved in that. It'd be good to have your feedback as well.
We certainly, I don't know about ongoing attendance, but depending on kind of where you focus things, I think certainly it would be advantageous for us as you're sort of shaping up what you think the committee is going to be talking about as sort of where we can help with data. Even as an aside, Catherine, I want to talk to somebody on the team, but while you were talking, I was exploring one of our online interactive displays where it's not going to be something that's going to be totally fix anything for you, but I was just thinking there's a couple of data points for mobility and foster care placement for kids with a behavioral health diagnosis. And just some numbers there that might be helpful for you to have in your hip pocket. So I have a question on the display that I want to follow up with somebody, but then I'll send you an email afterwards.
Okay.
Just so you know it's there.
Okay, great. Thank you.
So yes, definitely keep me in the loop, Ellen, and because obviously that's why we're here, is hopefully to help.
I have a question. I don't know, Gretchen, if you know this from the numbers, or Catherine, you guys have, but looking at the chart, figure 9, the 9th grade foster care tied to lower risk, there was this peak in 21, 22 for kids being on track, in a positive thing. Is that because during COVID, the bar was lowered, or okay, Catherine's shaking her head. Yes.
I can't.
That's really interesting. Not what I would have expected.
It was. I will say it's probably a combination of a couple of different things. And I don't know this for certainty with data wise, but I do know that schools, when they were online during COVID, were much more flexible with kids in how they got work done, accepting things that were late. The options were just more flexible. I also think that absenteeism was lower because kids were going to less appointments, they were staying home. There just wasn't as many demands on things. And so I would guess it's probably a combination of factors, but I do think that the pandemic probably played a role in that.
Thanks. Just very curious to see it. It really jumped for youth in foster care, students experiencing houselessness, and economically disadvantaged students. So it feels like the schools could take some tips on their flexibility and how it impacted some of those kids. But
yeah, I agree. I think that's something for us to look at. I was hearing, and some of this was just school administrators saying this to me in, side conversations, but if kids were late on something, they just offered way more flexible options for them to be able to complete the work because they knew there was a lot going on at home for families and juggling everything. But I think it's a really great point to point out that maybe that flexibility really helps students.
Yeah, I mean, at least based on this chart, super interesting.
This is kind of off topic, but one thing that I didn't realize that I'm now learning, and maybe it's a small town thing, is I have one of my kids that is leaving public school to go to a different, I suppose, a charter type school, and he still gets to play sports with the public high school. And I didn't know that was a thing, and I think that that's a really cool thing that we allow in Oregon because, I was thinking if you leave school, you're out of any recreations that they have, but being able to keep them connected to their local community through sports, I think it is a great thing that we do. Now, I wasn't sure if that's a small town thing or if that's statewide, but
that was a legislative bill that was passed. I don't remember the year, but I remember being the bill analyzer. And so if I remember correctly, it may have been pre-pandemic, but it was definitely a bill that was passed so that all kids in the state of Oregon could have those opportunities.
So cool.
Well, thank you.
Thank you so much, Catherine.
And we'll be in touch. I will meet with Ellen and we'll figure out a plan and move forward from there. So thank you very much.
Yeah, thank you, Catherine. Really appreciate it. And hello, Rachel. I just sent you an email. And while you were trying to join, I was emailing you. So welcome. We're happy you're here today.
Yeah, welcome, Rachel. Good to see you.
Yeah, it's good to see all of you. Glad to be here.
Well, we're just wrapping up around education, an update from Catherine, which is really helpful. And I think you're next up on the agenda. We do have a new member today. So if you could introduce yourself with a little background, Rachel, before you start, that would be great for our new commissioner.
Wonderful. Well, hello, everyone. Rachel Kearns Henry, she, her, hers. I'm with Governor Kotek, and I serve as our Senior Human Services Advisor for the governor. In that role, I work closely with to advise the governor. I work closely with our Department of Human Services and our System of Care Advisory Council and our Long-Term Care Ombuds Office are my three main areas that agencies and groups that I work with. Part of my job is to help understand and navigate the policy landscape, working with our legislators, working on just vision and implementing governor's vision for for some of our direction we're working on within our agencies. And we also work to help navigate and understand what are the budget priorities that we need to advance and how do we ensure that we continue to advocate to get those budget priorities advanced during the regular budget process. So I do spend quite a deal of my time. I've been learning about all things DHS and have been in this role for over 2 years now. I guess it's been that way. So I started with the governor right when she started office in January, and have been in this type of advisor oversight role over public administration, it's really called, where we really help to make sure that we're working closely in partnership with our agency directors on how to ensure that we're continuing to advance and move forward. So I work closely many times with Fairbourse Pakshresh, and then the program directors, April Flint Gerner, for example, for child welfare. And we regularly connect and kind of work through kind of where are we headed, what's our vision, and where are we moving forward. I think you asked my background, just briefly, how do I come into this work and how do I approach it? My background is formal training is public policy. That's where I have a master's in public policy from the University of Chicago. I spent over 12 years leading in the state of Wisconsin in the Medicaid oversight. And I worked at the department level, working on legislative policy and healthcare reform policy in the state of Wisconsin. I worked on our child health welfare foster health home and our maternal child health homes back then. So kind of have dabbled and led across health and human services. And I have been here in Oregon since 2019. I started first with the Oregon Health Science University as a Center for Evidence-Based Policy, where we work on gathering 25 state Medicaid programs and advancing collaborative best practice. I see Gretchen Worley's on here. She was a former colleague of mine in that role. And then with the COVID pandemic, came over and started jumping back into state service because I realized that's really where my heart is helping us to move things into action. And a lot of my time has been spent during COVID helping to bring both Oregon Health Authority and the Department of Human Services teams together, and how do we bring the public health response into DHS, and then started really just learning more about the overall DHS and how do we keep things moving. So I went from that role and just working in the leadership positions within DHS over to the governor's office when the governor started in 2023. So that's my background and who I am. And I don't even know if I've shared that with the whole council before.
I don't know if you have. I always get hearing new things.
Get a sense of who I am and what I do. So appreciate that. So I am here to give an update. I think maybe just I think about this in terms of different kind of buckets of updates I can navigate. One, just want to talk about legislative session right now. Where are we at with kind of the state of legislative session, key policy bills, then talk about fiscal and where we are with our fiscal areas, if you will, and what that timeline looks like. I do think it's helpful to also maybe give some overviews of what's happening at the federal level and kind of our monitoring there as we think about federal changes as well. And then happy to do anything else in terms of public administration or kind of policy. Here's what else we're thinking. Here are some key initiatives that we're working on, just in terms of the day-to-day operations of the agencies as well. So I can do that. And if there's anything in particular you want to make sure that I connect on, this is a discussion in my view. So please feel free to jump in and to connect. So the first thing I wanted to talk about is, and I really do want to have this as a discussion. I want you to, and I hope you can feel free to raise your hand virtually or just go off mute and pop in. But we have been working with our System of Care Advisory Council, which I think many of you know. I know we've had Anna Williams, the executive director, come to this group before, and Michelle Pfeiffer is our government relations lead at DHS, who's been here as well. But the System of Care Advisory Council has been working over the last 2 years on to this question of how do we need to, are there policy provisions that we need to address to help improve how we advance improvements in our child behavioral health system and child welfare settings? We had been working with them through just the genesis of their safety work group and having a lot of those questions in particular as we built out the governor's recommended budget. And we're looking at, and then also looking at our child welfare strategy. Where do we need to make investments? Where do we need to make improvements? And we said, as we were looking at this, what became clear was that there are potentially some changes that need to be addressed in terms of the regulatory landscape that we are operating in the state of Oregon, in particular, that we are suggesting that we navigate in a different direction. One of the things that became, as we were looking through just the examples and the history from what this group has been working through, there was a lot of confusion about different definitions of seclusion and restraint and child abuse across different settings and different standards, different definitions. And we had just acknowledged that we've seen a drop as well in the child and family behavioral health workforce that we've had in the state. We've seen about a 40% drop in the recent years. And we're trying to understand what is happening and why, and how do we help to address some of those core barriers. And part of what we had heard was and just in talking to providers had been that what it means in terms of the additional requirements to be a child caring agency in Oregon with some of the regulatory requirements. Some of those provisions they're intended to ensure that we are maintaining child safety, absolutely. And some of them have been perhaps had unintended consequences. And how do we also have balance and ensure that we have access to care for kids? And so what we're attempting to do as we're navigating this bill is to ensure that we are having common definitions of child abuse and being really clear when is something a seclusion and restraint action a child abuse investigation versus when is it just a general prohibited action and licensing investigation. Because what happened over the years is that instead of just having regulatory processes that we would normally do to oversee our facilities and our child caring agencies, and are you doing things right, and how do we need to navigate together and have progressive discipline, all frontline workers ended up, we ended up having a very high threshold and frontline workers being investigated for child abuse many times in lots of situations that perhaps we wouldn't say are warranted to be the level of child abuse. And that's part of that type of hard discussion that we're navigating and the thread that we're trying to weave here as we think through these definitions. So what we're really looking at is making sure that it's clear when and how are we thinking about when do we need to have investigations for child abuse versus when do we need to have investigations that need to occur at the licensing side. And I say that with this nuance because some of the questions and I would say opposition type discussions have been like we're removing all discussions of child abuse and that we're going to harm kids. And I just want to be really clear, that is not true. We are actually continue to have prohibited restraints as prohibited restraints. We're continuing to navigate and have those areas in statute. We have been working on a series of amendments to help address and remedy some of those concerns that we've heard. So for example, we'd heard concerns about when is it something a prohibited restraint and versus when is it an abusive, a wrongful restraint, and how do we add clarity? And we're adding clarity on what constitutes abusive restraint, and you're going to see changes in that amendment to add to ensure that we have clarity there. And those are some of the areas that we are navigating in particular with the definitional changes. So we are working right now on those definitional changes, and once that amendment language comes out, we'll be able to share feedback with everyone on what that is included and why. But some of those, but that's a main component of what we're trying to do. Clarity on what is abuse, clarity on when is it an automatic child abuse investigation versus when is it that we need to look at the criteria, have it be a licensing violation, and then escalate if we needed to the child abuse level. But making sure that we're trying to get the process flows right to get our system moving. And our goal, again, is to ensure that we can help to ensure that we have a regulatory environment where we can recruit and grow our child and family behavioral health workforce. And that is part of what we're looking at in those definitional changes in terms of our why. The other element that we are navigating with this bill is navigating thinking about access to care for kids within child welfare, and in particular, what we have. We want to ensure that we are able to get medically necessary treatment when needed to our kids in child welfare. That could be that needs to be out of state, for example. What I want to be really clear is we are not in a place, and we are not trying to send all kids out of state as had been historically. Sorry, I just saw Casey's note in the chat, and I'm happy to reach out to you, Casey, and talk through that. We are not in a place that we ever want to go back to some of those past behaviors, but what we do realize that we have is that we've created in our system inequities, essentially, that if you are a kid in child welfare and you need access to medical necessary treatment that is not that any other kid in the Oregon Health Plan could have access to, you're not able to do that right now and get access to those services because essentially you have to be, that outside entity has to be certified as a child caring agency in the state of Oregon. So what we had is we have had some circumstances where we've essentially had to break the law to ensure that a child could get life-saving treatment in another state for a period of time because they were not able to they weren't licensed as a child caring agency in Oregon, but that was like a regional best center for how to serve in a certain that child's specific circumstances. So what we've really tried to do is make sure that we put guardrails around this, and we have to put guardrails around to ensure that there are rules about when and how any sort of out-of-state treatment would need to be authorized. Especially, we have defined a rulemaking process that the department would do to help identify any of those circumstances. There would need to be going through any of the Oregon Health Plan medical necessary review processes as well. We've included an amendment making sure that the court also does a review before it would go over. And so what we've really tried to do is learn from our past and identify what are all the guardrails so that it is a rare circumstance when that would be needed, but if needed, that you would have access to that care. And then we've added in the additional reporting and follow-up that would be needed from reporting back to the state in terms of monitoring how things are going and reporting those trends so that we can make any adjustments as we need to. Now, those end up being those two main goals in terms of looking at the definitions so that we can have definition alignment for consistency, and then identifying how do we have access to care are the two main goals that we really are navigating and areas that we were looking at to advance in the bill. The bill started off really big. There were all sorts of other components in it as well, but we've really tried to narrow it into the priorities. You're going to see as we work on amendments, for example, we are not making big changes in our school settings because we've just in talking to our education lobby and others, we've said, let's hold off on some of those discussions and have a task force that's going to, or a work group. We haven't quite determined what that language would be, where we would work on some of the education areas in a different setting in the following year. And so that's part of some of that type of navigating that we're doing on that bill in particular. So in terms of status of where that bill is, it's currently in House rules. And so we're anticipating that the bill, we'd have some discussions in House rules in the coming weeks and during those amendments. And that's when you'll have another public engagement process. And then we'll see what's next as the bill would carry on from there. But right now, that bill did move out of the House and then moved into the House rules. And this is a bill that we are really prioritizing our time and spending time on because we do feel that with the work that we know we need to do ahead for child welfare and transformation, we need to invest and we need to put money and we need to do those things. But what we also recognize is that we also need to ensure that the environment that we work in and that the policy environment to ensure that we have providers who can serve kids, we have to also focus on that. We have to do both things so that our investments that we are putting into the system, we have providers who will serve and that we can help to make sure that we grow what we need here in Oregon. I spent a lot of time talking about that, but that is our big focus right now and where we're spending our time, and I'd be happy to answer questions about that bill.
And commissioners, this was the bill where we had folks come several times and present on it, and we offered feedback, and it was written up and sent to them. Like one of the recommendations we had was actually to have court approval for children being sent out of state for treatment, and that sounds like it's getting put in there.
It is.
So that's exciting. So if there's any questions, I'll pause.
It sounds like there are amendments that are addressing my 3 big concerns there, so I'm really happy to hear that.
Thank you, Judge Jaco. Yeah, we are we're trying to be mindful and listen to what the concerns are and how do we ensure that we address those while meeting our goals at the same time. And that is what we are attempting to do. And I should just confirm, what were your 3 concerns, just to confirm?
Well, with extending the kids out of state, that the court had a chance to weigh in before that happened. With regard to that having it be too big and all the sort of auxiliary concerns that were included in there, I think that focusing on your main 2, trying to grow the workforce and having them be able to basically get people to work in that area, I think that's a key goal, and it makes sense to try and, especially with the behaviorally difficult kids, have providers also be able to invest on having more providers in the state that can deal with some of that.
I don't know if you've seen the document, Rachel, that we put together from all the commissioners' concerns, but if you haven't, I'm happy to send it to you.
Sure, happily. Again, hopefully that had been in my inbox as your liaison in working on this bill. So I would very much appreciate it.
It was a request of Michelle and Anna, so we made sure we got it to them.
Great.
My only other question, Rachel, thank you for the update. I know that bill is huge and has gone through so many discussions, but are there providers and organizations kind of waiting in the wings who, if this were to pass, they're going to be stepping forward to engage again in these services? Or is it like we're hoping it will? Because I think part of the reason I've been hearing from folks who leave that field is the low wages, the high stress, the risk to yourself and harm to yourself being in those positions. And I don't know if any of that gets addressed by this bill.
So I think just like any policy change, part of what we're truly trying to navigate is starting to move towards that more trauma-informed environment, and that takes time, and that takes culture change, and that's going to take time. So our hope and what we are navigating is that we hope that by making some of these policy changes, we will be able to continue to work with providers to help to come back and to serve kids. And I do think that will take time, but we do hope to measure that and to monitor and to see how things are going. That is part of our objective.
Hey, yeah, sorry, I have to actually go now. So I want to let you guys know, and sorry for not contributing much in this meeting. I've had to do multiple things while doing this. So anyway, have a great day.
We appreciate you. We know you're headed off to Hawaii, so it's okay that you weren't totally focused today. I would find that hard as well. Safe travels, Dean.
Rachel, I wanted to say that the third thing is making sure that there's adequate monitoring when a child is out of state, and it sounds like you're finessing that too. So.
Yes, absolutely. And making sure that we have actual site visits that occur on a regular basis, in person, review of the facility ahead of time, putting in so that rules need to make sure that we've done a review to see how close are they to at least meeting our standards and certification. Because the barrier is like, we need them to be close, but actually doing the work and becoming certified and doing a 6-month application process to become a CCA, that's just not possible. That's just not what our providers are going to do. So we're trying to make sure that we are reviewing for those areas and making sure that, of course, if they are bad actors who have had historical challenges, that those are not places that we would ever say yes to, but making sure that we do have protocols in place to be able to get access to care if needed.
Well, especially when they're so specialized that they can only serve, a small number of kids, like the eating disorder places and things like that. They're not going to get certified in every state because they're not necessarily always going to have a kid from every state, including Oregon.
Yeah. Yep. So just acknowledging, I mean, that's a bill where we are spending time there to make sure that we are listening and get this right. And we know that not everyone's going to be happy, right, with everything that we do. But part of what we're trying to do is to strike balance and to meet people in the middle to make sure, again, that we are moving our system forward. And this is a step forward. This is in the spirit of continuous quality improvement. If there's changes that we need to make in future years, then we know that that's what we'll do as well. But we want to make sure that we're at least advancing some of these policy changes at this time so that we can continue to do the child welfare transformation work that many of you have heard so often from April Flint-Gerner and others to talk about. I think one example that we've given in the past is we've had a request for a proposal out to help try out this model of like the 1 to 2 bedroom homes. And our providers have said, it's too much right now with the regulatory environment. We can't say yes. So that's where we're hoping, and we're stating, all right, well, let's make these changes and let's see, can we get someone to say yes, to step in, and then to be able to help work with the kids. That's what we're trying to set up that environment to do. So we will monitor and we'll see how we do if the bill passes at this point. So, at this point in the legislative session, we've met that halfway mark. We have where bills had moved out of their first chamber deadlines, and then kind of where the heart of the meaty discussions are happening. That's really the stage that we're in right now, and that's why I'm talking about this bill where it really gets deep. There's other bills like that that had been put forward that are not moving on at this time. For example, like I know that there had been some review over having a separate office of the child advocate, for example. Again, legislators may decide to move forward with elements of these in other vehicles, but at least the main vehicle there was just process-wise in terms of committee, that committee of those amendments did not advance, so that bill did not move out of that first chamber deadline, for example. So that's an example of just some updates on some bills there. And I'm happy to, if there's any bills that you know of that you want to flag in particular, I'm happy to, if I know it off the top of my head, I'll let you know. Otherwise, we can go back and look into those bills as well and give you any updates. But we're spending our time, in addition to that, those policy bills, we're really making sure that we're advocating as well for what are the budget investments we need. Because the budget investments then are we've gotten through, our agencies have presented during Ways and Means, in 2 minutes right now. Then we have a second round of Ways and Means presentations, and at 1 o'clock, the Department of Human Services Youth Experiencing Homelessness team is going to present on why it's critical to maintain the almost $20 million investment that had been put into the budget that we're proposing to maintain again going forward this year. That's an example where we are advocating for what are the key budget investments that are important to maintain within the governor's budget. That's primarily where our department is focused right now. So that youth experiencing homelessness is an example of that. There had been the dollars for helping to reduce temporary lodging, continuing to make sure that we have money for treatment and prevention for Family First Services Prevention Act dollars, making sure that we have proper oversight of our contracts in child welfare, which was another hot issue that we thought was important to address. We had $10 million in residential treatment within the Oregon Health Authority to grow our treatment capacity for co-occurring diagnosis for kids with mental health and substance use disorders. We have school mental health prevention investments that are included in the OHA budget and some other community behavioral health spending. Those are some areas that we are continuing to advocate for, and in a really tight budget environment. I also want to note the budget environment that we have right now, like what will happen is at some point in May, there'll be another kind of forecast that comes to identify here's where we really are with the May forecast. And that's when you'll start seeing the legislature start shifting to then having some of those discussions and moving forward with decisions through Ways and Means for budgets for big departments. So at this time, we're kind of in that wait and see mode, and just all the kind of first line advocacy and clarification of what is included or not included has been advanced. And again, advocacy is important right now because as legislators are making hard decisions, they have to choose. Part of the other discussion that complicates this is thinking about how do you make these hard decisions, especially with uncertainty that is happening at the federal level. And just want to name that, right? And part of how we've been really thinking through this and advocating when you think of the potential federal cuts that are being proposed, in particular, key investments for the Medicaid program, reductions in food services, SNAP programs, reductions in TANF spending, elimination of the social services block grant. Those would have really big impacts, and I can speak to some of those at some other time, or I can go into some of those today too, on our system and holistically what we want to make sure that we're clear on at a state level, and governors want to make sure that it's clear, is that states cannot backfill. The level of funding that is potentially being discussed is just not something that we can somehow have our state legislators put money aside and we're going to be okay and we're going to take this all on. The significance of the funding decisions being made are very large, and we feel that advocacy and pushing to ensure that this is not how we this would be an unfunded mandate from the feds coming to states. That's a really important message, and that's where we're really trying to push and really talk about this from that advocacy level. So then at the same time at the state level, what we need to make sure we're happening is we need to make sure that timeline-wise, we have to get a budget through, and we have to get a budget through that reflects Oregon values right now. And And again, we don't want to compromise the fact that we can't backfill for all of these federal cuts. And if we need to come back later and address some of these things later, once we know more what's going to happen at the federal level, we will. But how do we stay focused on getting a budget done in Oregon that we need to within our time period? That's really where we're trying to hold firm. There's a lot of in terms of like, when are we going to know what's happening at the federal level? There are some deadlines, right? In May, and Memorial Day is when you've heard some potential deadlines for what should the actual markup and the proposals be for how we could find some of these levels of savings. But even then, it's not clear, okay, well, are those, are we going to meet those deadlines? And then the disagreements that we have potentially between the Senate and the House and how you find those savings, it does appear that it's going to be taking some time until we have a really clear idea of what potential changes would be coming. So from that perspective, we're raising awareness, we're making sure that we're quantifying, we're being ready, and we're planning and thinking through these things. But at this point, it's a hypothetical, and we need to stay focused on what we need to do for Oregon. And when we come back together in the summer to continue to plan, we will. And that's how we're really trying to think through this really challenging kind of tension point of we need to keep governing, we need to keep moving forward, and then we'll advocate, and we'll plan when we need to, when we know what might be changing at the federal level. I'm repeating myself, just helping to make sure that like we're all like, that's where we are and that's why. So happy to take any questions there as we think about kind of the environment that we're navigating and what's ahead.
So assuming we don't have information from the feds about what they're going to do by the time that you need a budget, are you proposing to deal with that with the e-board?
So I think those would be different discussions. I don't know exactly what that mechanism would be. Those would be probably, it really is dependent upon larger discussions and the magnitude. So I would need to hold those discussions till later with, that would be presiding officers, governor discretion on how they want to look at this in the future.
It's tough. That was very tough. Thanks, Rachel, for that overview. Any questions about the budget or the big policy bills?
The one thing I would say that is promising from my view is that I haven't seen significant changes on Title IV being identified in the child welfare space, which is good, right? Like that's what we want. However, what we are navigating is that the TANF spending that we do, the social services block grant, the Medicaid funds would still have it. Those are significant part of the infrastructure and how we support kids and families that are in our system in Oregon. So there are still impacts. I want to be clear, but it is promising. I feel like I have to have something. Like it's promising that so far we haven't seen a Title IV reduction. So that's like the one glimmer of hope that we have.
Yet.
Yet.
Yeah. That's all going to be very hard. It looks like people are starting to leave to get to other meetings. Any final questions for Rachel?
I went ahead and sent you the info on 3835. So you
wonderful.
You'll have that in your inbox.
Sounds great.
Awesome. Well, thank you. If we have any other questions, we'll follow up. And then I guess just good luck. I don't know when we'll see you again or if it'll be after the end session. So just sending lots of good energy your way.
Thank you so much. We need you all to continue to help advocate and raise your voices and continue to let us know where we need to be thinking and making changes. So appreciate your leadership and your work by serving on this commission.
Thank you.
All right. Thank you. Bye-bye.
We do need to do our public comments. I think even though we're running a little late.
We're a little bit late, but for those who are left, if they wanted to say anything for a public comment period, apologize, we're a little bit over. I think Matthew had to get off. Oh, his computer's dying.
There you go. I just had, as a grandparent, and the fact that I was out of state and worked through the foster care system to become a foster care parent. And then someone decided to take my children one day, and I have never seen my grandchildren again. And my daughter did sign her rights away while she was in prison, and that was not for childcare, foster care, to readopt them out. I have been looking for them here in the state of Oregon for about 2 years now, pretty much located my grandson and just trying to get to answers behind, like, why you split up twins at the age of 5. Coming to trying to find answers, because as a grandparent in the state of Oregon, I had no rights. They were taken from me. I was cut off back in January 11th, 2011. Their names are, can I say their names? Isabel and Asa Cruz Bostic. And I worked for the airlines and then went and got a job in the stock market so I could help to take care of them as I went through the process of, I flew here every week, every 2 weeks, probably every week to every 2 weeks, to pick them up, take them to see their mom in prison, very much a huge part of their life. And then for the state of Oregon to come in and take them from me, and me not to even get to say a word or find them. I've been devastated, and it's taken me this long to be able to have words for it or to talk about it, because I usually am just a hot mess over it.
I'm so sorry.
Honestly. Yeah, and you guys will probably see more of me because I'm kind of coming to, be able to get out and talk about it and what happened. So, and I didn't want to, I wanted you guys to also, people to be aware of what happened. It's devastating, that this can happen. And, just because somebody says something, and it was out of Lane County. So just so you're all aware. And still to this day, I really don't know where they are. I don't know if one of them passed away. They fed me all kinds of things, and I just want to be a part of their life. My grandson was autistic, so I see how far, and got him to, bloom. And just as he was blooming and going to kindergarten by himself, because, his sister became his protector. And to see him bloom like he did, and then for them to come in and take him away from me, I just, I just don't know what happened to him. Yeah. And I just want to know. I think every parent and grandparent has that right. I can turn on my camera if you want to watch me cry.
Alicia, I'm happy to talk with you further about this. And
thank you.
Try to help you maybe make some connections about where you can go and who you might connect with.
Okay.
I'm going to put my email in the.
I can give you mine if you'd like. It's just my first name. It's my first name.
One second.
Okay.
Yeah. Okay. It's your first name.
Yeah, my first name, my last name, the number 168.
168.
At Gmail. At Gmail.
At Gmail. Okay, I'm going to put mine in the chat, and you that way you just so that you have it, and then you can reach out, and we'll see who we can connect you with. I'm so sorry for your pain. That's really, really hard.
It's been horrible, and they've kept me very limited on my funds, so I can't, whoever's done this to me and did this. And it's just been the craziest ride ever. And I just want them to be a part of my life again. They deserve it. My daughter didn't sign her rights away for somebody else to go out and adopt her, adopt them, I guess I should say.
I appreciate you sharing that. It sounds really painful. And I know Ellen can get you connected to.
Thank you, guys. That's what I'm just looking. yeah, just to like give me somewhere to start, because here we don't, and my whole thing is I really truly believe that grandparents should have rights. I mean, it's just been the craziest thing ever that, and I saw my grandkids get switched between, because I was flying, I worked for the airlines, so I was flying here, picking them up for the weekend from my foster parents that were here in Oregon, and to see them go through 4 or 5 different, I'm a huge advocate for you guys, 4 or 5 different placements that they were in at that time. Yeah, there's problems, but like you guys, I heard you guys talking a little bit about, like the abuse, because it was always like the poor parent, whoever they were with, it was considered abuse. And I don't know necessarily, yes, my grandkids are Hispanic, so they tried to put him in a Hispanic household. Well, that didn't work for him because they were raised with me and my daughter who are Caucasian. And so that one didn't work. And then the next one came, and, it was just one after another that they get replaced in.
Yeah.
Okay.
Well, one of the things, I don't know how long ago this is, and obviously these are things we can talk about when we meet, but just that child welfare has a commitment these days to really try to make sure placements are with families. So maybe some of the things and the problems of the past, hopefully, with these new, the new ways that things are being done, hopefully, there's more assistance for other people so they won't have to go through what you've gone through.
Yeah, and that's my huge thing, is just to make sure no other family ever has to go through what we have gone through. I can't fix the past, but I can make sure that no one else does that, or has to go through anything like we went through.
Well, I put my email in there. Feel free to reach out to me. I'm happy to have a conversation with you at any time. I know we have to end our meeting because we're a little late.
No problem, you guys. I appreciate you letting me talk, and everything's been great. Thank you.
Yeah, thank you for coming.
You're welcome. Bye-bye.
All righty. Well, thank you for commissioners for hanging in there and allowing Alicia some time to share her story with us. Hopefully Ellen and she can connect and we can get an update next time we meet, and just to see that there's some.
One thing I noted we did not do, and we've lost a lot of people now, but we were going to talk about that report. We didn't talk, I don't think I even included it, because when we talked about the agenda, we didn't remember to talk about that report. You know which one I'm talking about? The one that was sent out, somebody sent to you, a former commissioner sent to you, and you.
Oh, I totally forgot about that. Okay.
So yeah, I just noted it in my, I just saw it in my notes, but you and I know we'll speak before, so we'll just
to the next meeting.
We'll be talking about.
All right.